I'm Lorelei Day with the City of San Angelo. I'm here with Dr. James Vredes, the local health authority. Today we'll be talking about coronavirus disease 2019, better known as COVID-19. Dr. Vredes, can you start by telling us a little bit about your background and what your role as the local health authority entails?
Background, emergency physician. I work at Shannon primarily. I do a lot of tactical medicine. I'm board certified in emergency medicine and in EMS. I'm board eligible in disaster medicine. Have a master's degree in trauma science. My public health background is almost nothing. My role is to make sure the city of San Angelo, Tom Green County, is as safe as possible from a public health standpoint. I've done so much learning, reading in the past couple weeks, couple months. It's amazing.
Okay. Well, can you tell us about COVID-19, how it spreads and who it affects?
Yeah, COVID-19 is a real sneaky sort of disease in that the vast majority of people that get the disease don't get any symptoms with it at all. They may get a mild cold, mild fever, mild cough, and that's it. And that's what's bad about it, is because these people, these 85% of the people that get the disease have almost no symptoms, and they feel fine walking around, they're doing great. But unfortunately, if you're not one of those 85%ers, you're one of the people that it affects real badly. And the older you are, the more likely it is to cause problems, at least worldwide, but that's not what we're seeing in the US. 85% have mild to no symptoms, about 12, 13% get bad symptoms, and okay. Another 3% has to get hospitalized in an intensive care unit. And those people tend to be sicker than regular pneumonia. So the people that have a COVID-19 pneumonia tend to be on a ventilator 3 to 6 weeks instead of a few days to a week like most pneumonias are. So it uses resources a lot longer for the same patient than you would for other pneumonias. We always think of it as an old person's disease, but we found out that at least in the US, like 38% of the people that get hospitalized with COVID disease are less than 54 years old. Half the people admitted to intensive care unit with COVID-19 are under 65. So we're not seeing the same only old folks disease that they've seen in China and what they see in Italy, and we don't know why.
How long does the virus stay on objects or in the air?
On the air, they're talking about if somebody coughs or creates an aerosol, maybe up to 3 hours, which makes it really rough for us to have somebody in a room and flip the room when that patient goes upstairs or to the discharge. We've got to give it time for all the particles to sit before we bring the ultraviolet lamp in, zap everything, and then clean the room. So that's hard from that standpoint. On particles, landing on objects, it depends on what the object is. If it lands on copper, there's not much copper laying around, but if it lands on copper, it stays alive for about 6 to 8 hours. If it's on cardboard, up to 48 hours. Plastics, up to 6 days. So it depends on what surface it is, and that's why we tell people you got to wash your hands. You touch a doorknob, you can't touch the doorknob, touch your face, or gotcha.
So you kind of addressed this already, but what are the symptoms of if you do have COVID-19?
Well, traditionally, the vast majority of folks are getting upper respiratory things, like mild fever, cough, maybe some aches and pains. But if you're one of those severe people, then you get severe shortness of breath, you're hypoxic, your oxygen level's not high enough. And about 10% of people actually present with GI symptoms. So nausea, vomiting, diarrhea. So
okay.
just like with influenza, sometimes people have upper respiratory, some people have GI. So we've had to expand what we look for.
Okay. So can you talk a little bit about the testing process and how long that typically takes?
Testing process, at least right now, what we have is nasal or oropharyngeal swab, a little Q-tip in the nose. That gets sent either to the state lab or to one of the private labs. The state lab that we send to is up in Lubbock, and they could do between 10 and 25 tests per day. So it's fairly limited. We send out to multiple private labs, and unfortunately, we're seeing up to 10-day delays in getting results back.
Other than washing your hands, what can people do to protect themselves?
Stay away from other people. I mean, that's it. When you look at how a disease spreads, part of it has to do with how infectious the disease is, how quickly it goes after a host, and other is, how many opportunities does it have to spread? If you're over there and I'm over here, your virus particles can't get to me. So no matter how infectious they are, I'm pretty safe. If I was right next to you, I'm in the area they'd be spread just with respiration. So the best thing you could do is, things your mom taught you: stay away from sick people, wash your hands.
And I do want to point out that Dr. Vredis and I are actually 7 feet apart today, so we are taking precautions. Over the weekend, state and local officials restricted access to medical facilities. Can you talk about why that's important?
A couple reasons. One, we don't want healthy people coming into hospital and perhaps getting sick, because there are a lot of sick people. But also, it saves us on equipment we use. Every time a visitor comes in who gets a mask, that's a mask that one of my cohorts doesn't have to use to actually take care of patients.
People may have heard it mentioned that we don't want to overwhelm our medical providers. Why is that important? Looking down the road a bit.
Well, there's a limited number of us. I think we have 10 ER docs at Shannon, maybe 11. If one of us gets exposed to COVID and has to quarantine, and they're out of the ER for 14 days, we can handle that. 2 of us, we could probably handle that. We can't handle if 3 of us are gone. We'll have to start bringing in non-ER docs. Same thing for nurses, for paramedics on the ambulance. It doesn't take a whole lot, because if a paramedic picks up somebody with COVID, they get it, test positive, then that whole shift for that station's out.
Yep.
We don't have the resources. In Italy right now, 8% of the total cases are healthcare providers. I was telling you earlier that we had kind of an informal meeting at work yesterday morning, and one of our docs said he thinks he's got about a 1 in 20 chance that he's going to die within the next 12 to 18 months because of COVID. And our other cheery doc said, no, I think it's really more like 8% chance. We just realized that this is a tremendous risk. Anything people can do to cut down on their risk and my risk would be greatly appreciated.
Mm-hmm. Absolutely. So would you tell people if they think they do have the virus, would you suggest going up to the hospital, or do you think they should just stay home altogether?
Most people who get COVID do not need to be in a hospital, do not need to see a doctor, and just stay home, because most of the people are in that 85% group that just has cough, mild fever, maybe some aches and pains, and not a whole lot of symptoms. If you come to the hospital, we're not going to do anything. We're going to send you back home. If you don't need to be hospitalized or really need to be hospitalized, you're not hypoxic, the last place you want to be is in a hospital. You want to be home.
Right.
And that way you're not spreading it.
Okay. So for those more serious cases, it's going to require respirators. Mm-hmm. How equipped is San Angelo to deal with that issue?
Last I heard, I think we have 36 ventilators at Shannon. We've got another, I believe it was 22 anesthesia machines that can be used as a ventilator. In New York and Washington State, where they've run out of ventilators, they're actually having to put a little T-piece on ventilators and running 2 patients per ventilator. In fact, I heard yesterday there's some places that are putting 4 patients on 1 ventilator. And it really doesn't work great that way, because each person's lungs have a different compliance, and they'll expand and contract with the same amount of pressure. So if you have 4 people on a ventilator, you don't just turn it up so it delivers 4 times the volume, because it still works out that one person gets way over-ventilated and one person doesn't get enough because it doesn't meet their needs.
So the state and local levels have limited public gatherings to less than 10 people. Can you touch on why this is important?
It's easily, we don't want the disease to spread. So many people are asymptomatic, they have no symptoms at all, that if you're close to people, you're going to spread the disease. The more people you're close to, the more likely you're to spread the disease. Let's stay apart. In Germany, they've actually limited, as of today, no social gatherings greater than 2 people.
So what does flattening the curve mean? We've heard that term a lot.
Okay. Flattening the curve has to do with how many people we see over what period of time. In the U.S., we say that this is our healthcare capabilities to take care of people. If all of a sudden we get a huge spike of COVID patients that goes up way high, we can't take care of these people in this range here. If instead of having a real narrow, tall peak, if we flatten the peak out, so make it goes over a way longer period, and it stays underneath that level that we're able to take care of, we'll be better able to take care of those patients. So quite literally, we're pushing the peak down. It spreads out so it lasts longer, but the peak isn't so bad that we can't handle it.
Moving forward to a cure, can you explain the complexities of coming up with a vaccine?
Most vaccines, like flu vaccine, even though it changes every year, is a fairly easy vaccine to make. You figure out what the antigens are, put it in, you get it. When they first tried making a vaccine to SARS, COVID-1, they found out if you give that vaccine, which is a dead virus, to people, they're more likely to get the disease than if they haven't gotten the vaccine. You didn't catch the disease from the vaccine, but just it's called immune enhancement. It makes it so you're more likely to get the disease. Same thing happened with MERS, which was another coronavirus disease. And we said, well, maybe doing a vaccine against a whole envelope is wrong. We'll just do the little spikes, as you see the picture of the spikes. Turns out they still give that immune enhancement. So now they found this one little piece of the spike that doesn't give immune enhancement, and that's the vaccine that they're actually testing now. So we knew it was coming. We should have done something before now.
Okay. So, Dr. Vredis, in your personal opinion, how long do you think all of this is going to last?
10 to 12 months.
Okay. And why do you say that?
That's just how long it's going to take to go around the world twice. And that's what happens with diseases like this. They tend to go around the world. China's in that recovery phase, but as people from the rest of the world kind of get sick, get better, travel to China, they'll get reinfected, we'll get reinfected.
Okay, well, is there anything else that we didn't discuss that you'd like to add?
I can't think of anything. It's the simple things, you know. Stay away from sick people. If you're sick, stay away from other people. You know, think how many other diseases that people say, well, my child's sick, but I don't want to stay home, so I give them some Tylenol so they don't have a fever when they show up at school. Don't do anything stupid like that. If you're sick, don't go to work. If somebody else is sick, don't go around them. Wash your hands. Again, what your mom taught you.
All right. Well, Dr. Vredis, I would like to thank you for being here today. We really appreciate it.
Thank you.
Appreciate your knowledge and insight. And thank you for watching. All updates are going to be posted on the city website and as well as the city Facebook page. So be checking there and we will keep you in the know.